All right, we're going to go ahead and get started. So I just want to say aloha to everyone joining us on the webinar today. Topic is Evolving Kupuna Care in Hawaii. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, there are just a few Zoom housekeepings that we want to go over. So next slide, please. So for all questions, please utilize the chat box or the question and answers box located at the bottom of your screen. We are not offering continuing education credits for the COVID webinar series, and all webinars will be recorded and available on the Hawaii Public Health Training Hui's YouTube channel. Next slide. So it is my honor to introduce you to our guest speakers today, and just want to let everyone know that I will be the moderator for today's webinar. But to introduce you to our three speakers, first of all, we have Hope Young. Hope is the Advanced Care Planning Coordinator for Kokua Mau, providing community awareness and coordinates the Let's Talk Story program for the Speakers Bureau. Hope joined Kokua Mau in 2017 under a generous grant from the Stupski Foundation. Hope received her BA from the University of Hawaii, West Oahu in public administration with a concentration in healthcare administration. She has enjoyed working in various capacities with seniors and the caregiving community for over 15 years. During that time, she has seen how important meaningful conversations and documentation can benefit families during times of crisis or illness. Hope enjoys being out in the community and sharing the importance of advanced care planning, and hopes to someday normalize the conversation to ensure that everyone's end-of-life wishes are expressed and honored. Our second sort of speaker, so Jeannette is here to help answer any questions after Hope presents. But Jeannette Koijane is Executive Director of Kokua Mau. Kokua Mau strives to make advanced care planning and open communication about care and support for those with serious illness and their loved ones, including end-of-life care, the cultural norm. Jeannette received her graduate degree in public health from the University of Hawaii and her undergraduate degree from Cornell University. She has been involved with hospice and palliative care since 1988, beginning in the field of HIV/AIDS, working with the AIDS Memorial Quilt as the Director of International Programs, and then in a variety of research and educational positions in Berlin and San Francisco. Jeannette has worked in the US-affiliated Pacific Islands, helping to develop palliative care programs through a collaboration with the University of Hawaii Cancer Center and John A. Burns School of Medicine. She serves as a volunteer advisor to Zahana, a participatory rural development project in Madagascar. And last but not least, I want to introduce you to Dr. Diane Paloma. She is the Chief Executive Officer for the King Lunalilo Trust and Home. Lunalilo Home offers residential care, adult daycare, home meal delivery, and respite care for Kupuna as directed by the legacy of King William Charles Lunalilo, the sixth reigning monarch of Hawaii. She is the former director of the Queen's Health System's Native Hawaiian Health Program. Prior to Queen's, she spent time at the John A. Burns School of Medicine as a faculty member, worked for HMSA and its subsidiaries, and started her career working for a private physician. A Kamehameha Schools graduate, she received her BS in Psychological Science from UCLA, MBA from the University of Hawaii at Manoa, and PhD in Healthcare Administration from Capella University. She volunteers her time as a board member for the Asian Pacific Islander American Health Forum, Partners in Development Foundation, Hui Mauliola, the UH Foundation, and serves on the City and County of Honolulu Commission on the Status of Women and the Bishop Museum Association Council. So without further ado, I'm going to turn it over to Dr. Diane Paloma.
Thank you, Stephanie, and thank you, HIPHI, for inviting all of us here today to share on kind of what's up and what's going on in response to the coronavirus entering our community, specifically looking at elder care and the elder care markets. I'm going to talk a little bit about what Lunalilo Home has been doing during the coronavirus, I'll call it an interruption, as well as what we kind of foresee are in the changes in the future for Kupuna Care. Lots and lots of changes with also end of life care. And so then we'll kind of segue that to Kokua Mau and my friends there. So just a little bit of background. For those of you who are wondering what a huliau is the Hawaiian term for a turning point, which I think this time right now during coronavirus is definitely a turning point or a time of change for all of us. In the Hawaiian dictionary, it's also an intransitive verb, and if you're kind of like a grammar junkie like me, intransitive verb means it's an action verb without an object. So to think of the past, to recall the past, is very innate to Hawaiian culture. And so when I look to the future, we always think of the past and see what we can learn from that. And so this time of the coronavirus is a very good turning point for us, but also a time to reflect on what were the practices and protocols that we had in the past, and how do we learn and grow from them in the future. Just really quickly, I want to point out this slide. So this is downtown Honolulu back in the 1920s. And the coolest thing about this photo is when I'm finding old pictures of Lunalilo, that cable car, if you can see, has the numbers 2020 on it. So I thought I'm going to try and use this slide for every single presentation that I do this year, because it just is so interesting that a photograph from the 1920s indicates 2020 on that streetcar. So 2020, here we go. And just to familiarize you with King William Charles Lunalilo, he is the 6th reigning monarch. He is the first elected king. So a very democratic process was followed in order for him to become that status, even though he had the birthright to do so. And Lunalilo, if you're looking at the meaning of his name, meaning the highest of them all. So getting so high where you actually cannot see it, proclaimed by his mother when he was born. And so by birthright, he was the king, and also by legacy in terms of what we're trying to do at Lunalilo Home to honor that legacy for King Lunalilo. And so I will, when we reflect on the past, we did have this huge previous turning point, which occurred in 1927, which is around the time that that photograph was taken with the streetcar of Honolulu. Prior to this, if you didn't know, Lunalilo Home was actually in Makiki, close to Roosevelt High School. And I have a picture here on the left of Mott Smith Drive, which is where they believe the original Lunalilo Home was. And in 1927, we were moved to Mauna Lua, which is now better known as Hawai'i. So you can see Koko Crater in the background. And this is my family and me walking on the beach in Mauna Lua. And so that was a huge time of change for us, in that we moved from a very centrally located place to Hawai'i. Now, and of course, if you think about Hawai'i in 1927, there was no Costco, there was no Coco Marina shopping center, there was no Kaiser High School, there was no Kaiser development yet. So really a very big change and shift for us when we moved out to Mauna Lua. But what that did was it allowed us to really focus on what was important, and that was the elder care. And over the years, we have grown. So we've been there ever since 1927. I will say it's the same structure. It's the same Lunalilo Home from 1927, same original tile roof, same 2-foot concrete walls. And so if you can imagine some of the challenges with home repair and deferred maintenance, but I'll save that talk for another time. But the values that we see in our strategic plan today are the same values when we moved there in 1927. So aloha, ho'ihi, which is respect, ho'omanawanui, which is patience, and I think we all are understanding the importance of patience during our coronavirus adjustments and alterations. Malama, to care for, kuliai kapono, to strive for the highest, strive for what is right. Laulima, which is what I think HIPHI and all of the other organizations around town are really learning about Laulima. And that's many hands working together for a common goal. And finally, Loko Maikai, which is generosity. And I have a little asterisk by Loko Maikai because that was King Lunalilo's nickname, right? He was known as this generous, benevolent king. And so when we think about the ways that we are transforming, we always are still rooted very much so in our core values and what we believe in. So I'm going to start by just sharing a little bit of some of the changes. These are some of our kupuna on the residential care side. Again, as most of us know, we are all now practicing social distancing. We have implemented a non-visitor policy, which was really, really hard for us in mid-March when we first started seeing the community cases of coronavirus coming up. All of our staff have been equipped with PPE. We've been working very closely with our medical suppliers, as well as taking a daily temperature for all of our staff. And this has been going on for the past 2 months. And I will say the hardest part is what I was sharing just with some of our friends before this is kupuna we're all human, we're all creatures of habit. And so when we implemented the social distancing, so instead of all of our residents located in one room to share a meal together, they are now spread out over 3 different rooms, our ohana room, the dining hall, and the breezeway. And so when you eat with the same people for the past 5 years, 3 times a day in the same location, facing the window, moving to another site is difficult. And I would say that change set off a lot of fireworks and behavioral outbursts at first. But we are getting used to it. And I think they are getting used to our Zoom conferences. So because we don't have visitors, because family cannot visit, we have enabled 2 tablets dedicated just for our kupuna to be able to coordinate face-to-face time with them. And the funniest thing is when they're looking at the screen, and I overheard one of the conversations and all I heard was, "Your face is so small, how come you're not here in person?" So getting used to, having our average age is 88, so getting them to use technology is something new for them as well. Our daycare side, where we usually would have, we have licensed up to 44 clients for daycare, has been suspended. They are anxious to get back to us and we are anxious to see them. But what we have done is created a meal delivery for those clients for the month of April. We're continuing in May as long as possible so that we do have some interaction with them. And we do realize the strain on families when we are not able to accept daycare clients just yet. We're working on a plan on reopening and really looking at the way on how we social distance them in a small confined place as well. And what has been the most remarkable is our delivered. We do hot and we do frozen. And of course, frozen has taken over most of our meal delivery program. We used to have about 1,000 meals per month. And for the month of April, we just did some of our statistics. We had 3,000, almost 3,100 for the month of April. And so it's really tested our capacity for our commercial kitchen. It's tested the capacity for our dietary staff, and everybody is helping out. I'll say yours truly, I'm doing meal services on Saturdays, but it's really seeing the need and that increase in awareness of kupuna that actually need meals on a daily basis. So that has tremendously changed for us. And it is probably looking very differently at the way we as a community feed our kupuna. And you see a lot of that coming through our city and county offices, through Malama meals, through Hawai'i Meals on Wheels. So that's been a big change for us. I'm gonna segue, this is one of my last slides. This is a shot of our back garden, and you can see the kalo beds. So we implemented this in, I'd say, the fall of 2019, and was it 2018? Gosh, all the years are blending together. But we have been growing kalo and we've been growing the vegetables so that we can put them into our meals for kupuna. We have been able to incorporate that finally into our meal delivery. So eggplant turns into pinakbet, kalo turns into, just last weekend, we put kalo in our pastela stew for clients. And we also do minced and pureed meals. So that's one of our little niche markets for our meal delivery program. But really our plan going forward with the coronavirus is stabilizing our operations after this, what I hope is a fairly temporary disruption, recovering from that and being resilient in our communities. Our protocols and our operational needs are going to change, and they are going to dramatically affect the way we provide that care. We see a lot of other organizations checking in on us on our financial sustainability, because they know that we are an essential service. We cannot close down. That to us, that was never an option of closing our doors for residential care. Reopening our adult daycare and reopening the admissions to our residential care, and the way we do that to ensure that we don't also admit a potential virus or a potential outbreak of anything is going to be of extreme importance now. And like I shared with our garden, we are also looking at the higher need for medically altered kupuna meals, where we cannot always just give kupuna hot dog, a bag of chips, and a soda because they may be diabetic or have medications that would definitely not allow them to achieve their optimal health. And I think finally is the definite need for that laulima value, that community navigation and expansion on how do we serve more kupuna even though we may be on lockdown. How do we serve more kupuna in terms of looking and preparing for what comes next in the next stage of their lives, I think is probably the way that elder care is going to dramatically change. And from all of the resources that we get, the State Office of Nursing, colleagues at the university, private foundations across the nation, we're all kind of just scrambling for this change that probably needed to happen a number of years ago. But for now, I think it allows us to hunker down for a little bit, reassess, reevaluate, and really look at how do we come out resilient on the other side of the coronavirus. And especially when we start to see the community opening up, we really want to be able to maintain that protection, that level of protection for our kupuna. And so I know that was a broad overview, and if people have questions, I'm happy to answer them now, or even if we don't get to the end of the hour and your question is not answered, I'm happy to take email questions or just to be a resource. And if I can't answer your question, I'll find somebody who can answer it. So that's my section. I'm gonna close my portion with a very big thanks to HIPHI and to my colleagues here in this, this never-ending commitment to kupuna. So mahalo.
Thank you, Diane. We're going to take a quick pause while we switch slides to Hope's slide. She's going to go ahead and share your screen. While that's getting set up, just want to remind everyone that you can place your questions into the chat box as well as the question and answer box below. And it looks like Hope is ready to go. So I'll turn it over to Hope.
Hope needs to unmute myself. Hi, aloha everyone. Thank you, Diane. Thank you, Stephanie and HIPHI for having us back. We really enjoyed being able to connect with people out there during these strange times. So how do we do that, right? As Diane was mentioning, actually, as she was pointing out, healthcare is going to be changing quite a bit over these coming months, years, more than likely. So how do we make sure that we're getting to the point where we're taking care of each other well? And so I'm with Kokua Mau, Kokua Mau is a 501c3 community benefit organization. We're statewide. Our members include health plans, hospitals, long-term care, spiritual care. We have churches, we have senior living communities. They're all members and they support us in the work that we're doing out in the community. I'm fortunate to work with 16 passionate volunteers across the state. And my volunteers are nurses, social workers, doctors. They're frontline individuals that see how important advanced care planning can be for everyone. So we like humor. I'm not afraid of death. I just don't want to be there when it happens. And that's a great thought, Woody. I'm with you on that. And we're talking about advanced care planning and why is it so important? Well, as we heard, the way that healthcare is being provided has changed quite a bit over the last couple of months. Advanced care planning in general, no one knows when they're going to become very ill. No one's planning to have an accident. But this is a way of assuring that your wishes are known by your loved ones and that they're able to honor it. But especially so in these strange times, COVID has changed the way care is provided. Hospitals are different now. Doctors' visits are different. I just had a doctor visit with my PCP, and it was a telemedicine visit. Things are changing out there with regards to how care is provided. So we like to encourage you to have these conversations. This might be a great time to start up these conversations to ensure that you know how to support each other and your loved ones and to choose your person. So we have all of these resources online on our website. And on our website, we have links to the Conversation Project. We also developed a toolkit of COVID resources that are all available on our website. So we've gathered all the different websites that share information and we put it all in one place. So before you go looking anywhere else, I would suggest you go and look at our website. You'll find a lot of different tools that are available. They have translations are even available. They have suggested different ways of approaching care. And so we want to make sure that everybody recognizes that everyone over the age of 18 should have an advanced healthcare directive. This is not reserved for the seniors. This is not reserved for somebody because they've got an illness. This is something that everyone should be doing at the age of 18. Because without an advanced directive, should there be a need for somebody to speak on your behalf, they have to figure that out. Who's going to do that, right? And if you're anything like me, you have family, and in family, usually it's the loudest person who wins, right? Well, this is your opportunity to take control of the situation and to ensure that there's no fighting amongst your loved ones. They're there and they're able to support you during your time of crisis. And that's by doing your advance directive. Sorry, a little blurry, but sure, she has the right to die. All she has to do is come out of the coma and ask. I know, I can't hear your giggles, but I'm going to take it that you're all laughing. So your advance directive, you can actually get a directive on our website, free to download. If you go to the lawyer or you do any kind of legal, doing your will, a trust, they will try and add this on. Please, just do the free version. It's pretty pain-free. We've talked about these documents in the past, so I'm not going to go too in-depth with these. But remember, your advance directive is two-part, right? So the first part is choosing the person that you trust. Choose people that you have had these conversations with and who knows how to support you. It doesn't have to be your spouse. It doesn't have to be grown children. It doesn't have to be a family member. It's someone that you trust and who is able to make decisions and advocate on your behalf. And you want to pick a second person, just in case something you can't get access to the first one. Give that person that you are choosing as your agent the information on how to make decisions by telling them what's important to you. How do you make decisions? It's usually based on what's important to you, right? So what makes the life meaningful? What makes your quality? What would it look like to have good quality of life? And then you also want to give them ideas. So for me, it's if I can't eat a steak and watch my Korean soaps, let's not try curative medicine. Examples. You can feel your way around those. And then it needs to be signed by either a notary or 2 witnesses. Now, here's where it gets interesting. Because of this pandemic, how do we get to a notary? How do we get to witnesses? Because your witnesses can't be your healthcare agent. It can't be someone who has inheritance rights. One of them can't be one who has inheritance rights. And it can't be a person who is in a place where you are receiving care. Well, Governor Ige signed some emergency rules which has allowed for e-Notary, virtual notaries. This is a great opportunity to get your documents notarized. It does require a little bit of work because both sides need to be technically savvy to work the conferencing, the video call, and both sides must have a scanner as well as email and a printer. So there are some logistics there, but there is a way to get it done. An alternate that we are telling people about during these strange times, you can actually do a video, a selfie video, state your name, the date, and use it as an advance directive. Give your wishes for care video. Make sure if you're doing it by video, you tell people how to access the video, you share the video with your loved ones, and you let your doctor's office know that you have a video for your advance directive available and where they can find that. So should that ever be needed, they have a means of accessing it. Now, I mentioned that I did a doctor's visit with my primary care provider, and I realized that there are a lot of things that we're going to be having to adapt. And what I would suggest is if you're doing a telehealth visit, use simple, very easy to understand words. Without the face-to-face, we don't necessarily get all the same cues during our conversations. By all means, we're seeing each other's face, but we might not be getting any nonverbal cues in the conversation. So use simple terms. Explain that COVID-19 changes the health field. Hospitals have changed their access. A COVID-19 patient is not allowed to have visitors, but they've also changed it so that a non-COVID-19 patient will have restrictions on who can come and visit them. And that varies from facility to facility. It's important to recognize that things are changing. And for that reason, it's a good opportunity to reevaluate what is important to you and what you want and what you would not want. Another document that may need to be reviewed is the POLST. POLST, of course, is a green form. It's meant for people with chronic progressive illness, serious health conditions, medically frail. The surprise question is, would you be surprised if this person was to die within the next year? And if the answer is no, I wouldn't be surprised, then they might be a really good candidate for POLST. Also to consider is there are a lot of kupuna that may not want to be in a hospital setting right now because of the pandemic. So they might be good candidates to consider a POLST for people who don't want to be in a hospital during a pandemic. As I mentioned earlier, things are going to change. The way that people are getting care is changing. So this is why we want to have really good goals of conversations, really intimate conversations, not just with anyone that we're working with in the healthcare field, but also our own loved ones. This is an opportunity to really communicate what's important and how we can be there and support each other during a time of crisis. So we have a quick, this is a good diagram of our advance directive and our POLST. Remember, everyone over the age of 18 should have an advance directive. So that's why, if you guys have time on your hand, I encourage you to go and do your advance directive. What else better could you do, right? You've got time. It is different than a POLST though, because a POLST is a standing medical order. This is actionable orders that can be followed by first responders. This is also something that can be followed by the medical field. It has been signed by a physician or an APRN, and it's a standing medical order. So these are very different documents. Everyone should have their advance directive, but not everyone needs the POLST. The conversation surrounding POLST, it is a time to revisit the POLST. you want to change, it's an opportunity to increase the awareness of different courses of action. It changes the question of what's the matter with me to what matters to me. And how do I want to make sure that my loved ones know what's important to me? It's also an opportunity to introduce concept of palliative care and hospice. If you're unfamiliar with palliative care, it's a wonderful benefit that it uses an interdisciplinary team. So you have social worker, nurse, physician, possibly a chaplain, but they're working as a team to provide supportive care for people with complex health issues. So they're not, you can still get curative care when you're using palliative care, but it is a wonderful benefit that can really help people during a health crisis. I have a friend who she shared her story of palliative care, and she actually was overwhelmed by how successful it was for her, that she was able to get SNAP benefits started for her. She was able to get rent assistance. She was able to get counseling for her kids. She was able to get all of this done through palliative care. So if facing the complex illness, we do say, ask for palliative care consult. Hospice, of course, hospice is something available for individuals with a prognosis of 6 months or less to live. And really, we do encourage early introduction of hospice. It should be introduced as early as possible so that the best care can be provided throughout the end of life. Hospice is also an interdisciplinary team approach. I refer to that as the Cool Kids Club because not everyone can join hospice, not everyone qualifies for hospice, but when you are able to be in hospice, you get your own doctor, you get your own nurse, you get your own social worker, you get your own spiritual advisor, and you get your own aide. That is your care team, and they are dedicated to providing you the best care possible in whatever setting you call home. So hospice referrals during COVID-19, conversations about goals of care and where the individual wants to receive care can lead to education opportunities surrounding hospice. We want to get people learning about these things further upstream and knowing about them sooner rather than waiting until the very end. COVID-19, you're not going to qualify for hospice because of a diagnosis of COVID-19. There needs to be underlying causes to get you into hospice. So that's one way of continuing to receive the best care in the home setting without having to go to the hospital through hospice. Again, we have our resources available. They're on our website. Please take a look. There are also these free complimentary conversation guides that are put out by our sister organization in California, Coalition for Compassionate Care. They are allowing us to download these for free. Normally you'd have to pay for these, but these are some great decision aids that they're making available to the public. So I encourage you to go ahead and download them and use them if you see fit. Our Kokua Mau resources, we have all of these documents online on our website, and they're translated into 10 different languages. So if you need bilingual information, by all means, we have languages available online. If you need to reach out to either Jeannette or myself, here is our contact information, as we would like to hear what you folks are doing out there. If you're not already on our Kokua Mau mailing list, you can shoot me an email and I will get you on that, or you can sign up for it on our website. We really appreciate the time that you've taken for us to be here with you. Thank you.
Awesome. Thank you so much to Hope for sharing that information. So just a reminder, please put your questions into the Q&A box or the chat box, and we'll go ahead and get started with our first question. So right now, people are wanting to support and volunteer in various ways. Are there volunteer opportunities for your agencies right now, and who can people contact?
Diane, I'll let you go first.
Okay, great. So while Lunalilo Home does not have the capacity to intake volunteers just yet, and then that's been one of the hardest parts about coronavirus, is that we depend so tremendously on a lot of our volunteers. What I will put in a plug for is our partner, Hawai'i Meals on Wheels, did have a very strong volunteer workforce, but because those people who were in the volunteer workforce were probably retirees, 60, 65 and older, they actually decided not to be drivers. And so that left kind of a void for us and Hawai'i Meals on Wheels operations. So I think indirectly it would help Lunalilo Home if volunteers had, you have to have your own car, you need to have a good driver's abstract. And if you volunteer for Hawai'i Meals on Wheels, those are the wheels and the mechanisms that gets our medically altered meals into the community. I'd like to say if in the future that people do want to volunteer for Lunalilo Home, we are, right now we just have to kind of take your name and wait until we can reopen. But there's a tremendous amount of people that are, that care and concern is tremendous and so appreciated. But until we figure out how to minimize the risk to our kupuna, specific to coronavirus especially, I think we'll have to hold off for now, and we're trying to figure out ways that they can virtually volunteer. So for example, yesterday I had Hope, your classmate, Sean Pimentel, on Monday with Lehua Kalima provided a concert specific for Lunalilo Home. We were able
I love it.
Live. I know, he was so gracious. And so the kupuna, and luckily we had like a decent sound bar in our ohana room, but the sound quality, because Sean and Lehua have this great recording studio, the sound quality was as if they were in the same room together. So we'll definitely take volunteers virtually, and until we figure out how to protect kupuna from the coronavirus, I think we'll have to hold off. And that's we rely so heavily on volunteers that it's going to be really, really transformational for the way we provide care, I think, to student volunteers, especially, right? Those students in the community that need volunteer hours, we would take them every weekend, and those had to stop. Even for University of Hawaii practicums, we had to stop those. So while my summary answer is just hold off for a second until we can figure out how to keep the kupuna safe. What about you, Hope?
Well, you have the whole staff right now on the webinar. Jeannette and I are the only paid staffers for Kokua Mau. The rest is our hui, our network, the people who are passionate about the work that we do. We're happy to talk with people. If this touches you, if our subject matter touches you, by all means get in touch with me or Jeannette, and we'll be happy to see if we can put you to work in some way.
Right.
One thing I will say, though, we have been trying, Hope has been working with different organizations to see about donations of PPE, because that's such a crucial piece right now moving forward and as we begin to open up. So I think that's another piece that we've been trying to see if we can facilitate PPE getting from A to B. But, to be honest with you, when we started 8 weeks ago, there were like 3 groups making PPE, and now it seems like everybody and their grandma is making masks and stuff. So that's kind of a less of a thing. But moving forward, we have to be on top of this and be thinking how are we going to continue to have enough PPE for people. So, but it sounds like, and there's other organizations that are looking for volunteers, but I would say call Diane. And call the Meals on Wheels. That's a great solution.
Okay, so next question is I work for an agency that is also a similar setting to adult daycare. How will Lunalilo homes implement social distancing through activities and social programs?
Oh gosh, so that is the question of the moment on how we reopen and how we provide the activity. So what we've been doing so far is just relying a lot on the staff to provide guided activities. So, basically you have rows of kupuna socially distanced, and we have them at least 4 to 5 feet apart because of the parameters of the space that we have. Besides the virtual concerts, besides the facilitation of activities, we are trying to figure out, so one of their most requested activities, of course, is bingo. But because bingo requires the use of cards and the use of, like poker chips, we have to have the staff wipe down every single one before they can.
Oh my gosh.
After, right? So you can imagine the amount of work that goes into that. So even things like drawing, pens need to be wiped down in between each person, right? So it just amplifies the amount and the level of work. What makes it, yes, it's a little tedious work, but to us, it's like necessary work, right? And then it's finding the Clorox wipes to do that, but I will say a lot of it has to do with the facility and the facilitator. We can do more demonstrations where you have somebody up front and either telling a story. We used to do a lot of food demos. I'm not sure how we're going to try and do that anymore. But finding ways to do more virtual interactions as well as guided interactions where one person is at the front of the room, kind of like in a classroom setting, somewhat probably not as engaging of an activity as we'd like. But for now, those are the modifications that we'll have to do in adult daycare. And that's what we do for residential care right now. Reading the paper out loud is something that we've always done. So now it just takes a little bit more time. So that person goes to one room to read the paper, goes to another room to read the paper again, and the staff are constantly switching because now our kupuna are spread out over 3 different areas. I hope that answered your question.
That was great, thank you. So Diane, this next question is also for you. Are there national or local reopening guidelines for adult daycare facilities?
So again, that's what we've been searching for. We've looked at the CDC, we've looked at a lot of the national data. There's very limited ones on adult daycares. And so we've also been looking towards a lot of the education materials, right? So as schools become open, we're looking at the guidelines that they're doing also for social distancing and how do you keep, what's normally a classroom of kupuna in a contained space. How do you mimic that classroom setting? And I will say that there are a lot of guidelines for long-term care facilities and SNFs because they are very much more similar towards hospital operations in a sense. But for adult daycare, I do feel that there is limited information on how to reintegrate and how to provide social distance opportunities for adult daycare. Part of our plan, so we are creating this plan on how do we reopen daycare, includes daily temperature checks, not just in the beginning upon arrival, but throughout the day so that they can monitor any changes with the kupuna. How do we monitor medications with social distancing? How do we monitor meals? Because that's been the most challenging part of this process is to how do you keep people socially distanced when they're used to doing activities, coming together for a meal, and then going back to activities. So activities are not as big a concern to us as the meals. Our meals usually are delivered on, reusable, washable dishware. And so when when we're able to bring over the meals to adult daycare from our commercial kitchen, which is located in the residential care side, we're talking about using paper products, right, or disposable things. So, I mean, so many little changes that we really took for granted, I think, before coronavirus occurred is now at the forefront, right? How we serve a meal, how we intake a daycare client, how do we run an engaging activity that fulfills their mental and spiritual needs, but not able to physically be, less than 2 feet away from them. That has been the biggest challenge for us. And really, when we think about kupuna, and in the same vein, when we think about kids and children, they really need that stimulation, the tactile stimulation, the immediate feedback and the response, which is what I think they thrive on. So we're still working it out. I will say, to answer the question more directly, sorry for going on and on, there is not a lot of guidelines available, which is what we're looking for, which is why we've actually looked toward the education and classroom guidelines to help shape what we think would work for kupuna in the same, in the same measures.
Thank you. And maybe kind of a follow-up question. You were starting to talk about different activities that you could be doing, not only with the adult daycare, but are there any online activities that families can do to participate with their kupuna from home?
So I'll just answer that very quickly. The only family interaction that we have so far is just like a Zoom chat. We were thinking, because we have a grant for a clinical psychologist who interacts with the family and with the kupuna, we would have to figure out the way to have, a webinar like this where you have multiple participants looking at the same screen. We haven't quite gotten there yet due to the technology and our limitations on technology, but I do see that as becoming, a regular thing in the future. I can't see it not. I can't see it only being temporary. That's what I'll say. Is that's gonna really be some way. We have families who live on the mainland. We have families who live on neighbor islands, and so they don't have the opportunity to physically be present. But working out time zones, working out who they get to see, and the nursing staff that has to bring the tablet to the kupuna. I mean, those are the details that we never really had issues with before, but now are very significant for us.
Thank you. So next question is for Kokua Mau. With e-notarization, how long does it take for the advance directive to be processed?
So e-notarization, it's probably like a 10-minute interaction. It's a video conference that's actually recorded and saved. The person who's getting their documents notarized would need to show their ID to the camera so that it can be recorded. And then they would need to sign their document in front of the webcam so the notary can see. Scan and upload that document. Email it over to the notary. Notary downloads it, prints it, stamps it, scans it, uploads it, sends it back. So that's probably going to be like a 10-minute process, 10 to 15 minutes. And then they have a notarized document on their side. And we would have the original, which we could mail to them or mail to their doctor's office if they wanted to do that. Did you want to add anything, Jeannette?
Yeah, I was just thinking, the sort of the usual thing we say, which is in order for an advance directive to be useful, it has to be found. So yes, there's this notarization process, and then you're in the same position that you were before, which is you need to discuss it with your loved ones. You need to share copies of that with not only your physicians, but also your loved ones. Allow people to ask questions so that they know what's in it. You know, Hope mentioned the video that you can do. You can also do a video. You know, you could have done that anyway, but it's a great opportunity to do that. So we have to think of an advance directive as a document that needs to be found. So it's very different than, you know, insurance documents or a will or a power of attorney. Those should be kept somewhat, they should be kept safe and not widely distributed, compared to an advance directive, which is really, you know, it needs to be found. So, and we always try to encourage, and on our materials, we have a little checklist. You know, it has to be shared with everybody who's going to be interested in your care. And again, people can't honor your wishes if they don't know what they are. So like Hope said, this is an opportunity to have good conversations, and we're seeing that some people really are recognizing the importance of, you know, of this time to have these conversations. So I would, as Hope said, there's a bunch of great materials on our website, scripts and things like that, so you don't have to figure out how to start difficult conversations on your own. There's icebreakers and other kinds of materials that are out there. And for people who are thinking, how would I do this with clients or patients, there's also some really good scripts there that are for professionals. So you're not scaring people, but having a good conversation that shows that you care about people and helping with those conversations. So those are some of the resources that Hope mentioned.
Thank you. Okay, question for Diane. Are you working with other daycare facilities in Hawaii who are finding themselves in the same situation as you, as a way to share information and problem solve?
Yes, actually. So our adult daycare director, Ivalani Quinn, is a part of the Association of Adult Daycares. While they haven't provided specific guidelines, I will say that we've been in touch with them because we want to know what they're doing and they want to know what we're doing. In particular, she's been in touch with the adult daycare centers that have remained open, right? So ours temporarily suspended our operations because of the unknown, you know, the unknown qualities of the virus. And what's unique for Lunalilo Home is that we have adult daycare and residential care. And in order to keep those two entities separate was a challenge for us because we have staff that cross over all the time. But I will say, yes, there is an association of adult daycare centers that we belong to, that Ivalani, our daycare director, participates with to look at best practices. And I see that question came from Candace, and Candace, feel free to email me and I can also put you in touch with Ivalani because she would know much more about what other adult daycare centers are doing and possibly can help each other out. Thanks.
Awesome, thank you. So last question we have is for Kokua Mau. Do you know if the notary will accept a photo image of the document if the client does not have a scanner?
We are living in uncertain times. A photograph of a scanned document of the ID, I suppose, would be acceptable. I think we'd have to look further into that because the idea is to have the ID being shown to the camera in one sweep. So that's kind of the challenge.
Yeah, you have to take a step back and remember what a notary is for. So a notary is certifying that not only is this person signing this document, look at the ID, but also you have to figure out that the person has capacity to be doing that. So I can see how, you know, you just have to think that some things don't change and some things, you know, some things have to be have to remain the same, that the notary would have to know that the person is who they say they are, they have capacity. I could imagine the photocopying work, like Hope said. But again, it's a new thing that we're trying to figure out.
Okay, thank you. And we'll take one more question, and this one is for Diane. So wondering what you're hearing within your network of professionals regarding reopening the assisted living facilities and care homes in Hawaii. When will it be safe to allow family members to visit with their loved ones? Is anyone facilitating this discussion locally? For those of us with aging family members in these facilities, will we get to see them sometime this year?
Oh my gosh. So that is the question of the year. I want to say yes, that absolutely there will be a point in time in the future where you will be able to come and hug your loved one in person. And so the conversation that we're having around with medical professionals, nursing directors, is that the word on the street is not so good. It's that until there's a vaccine or until there's significant, I think this is done through antibody testing, right? Unless there's significant immunity in the community for the coronavirus, that we will not be able to open it up. Now, that being said, I will say that Hawaii has been one of the best states in the US to be able to find ways of contain. It could be many people are attributing the fact that the UV light here, or there is other talks about because there's so much travel from Asia through Hawaii to get into the US, that we have probably been exposed at some point. Now, I don't know how accurate that is. That's not me speaking clinically. That's just anecdotally. But when we do figure out what the safe time is, and we've talked about this just internally at Lunalilo Home, we're actually looking at possibly also being able to do contact tracing for the one individual that we'll let visit. So just prior to us closing our doors, this is only really like for the I think it was the first week of March, we only allowed one family member to visit the person, right? So you couldn't have a whole family come to do a birthday gathering, which is what was the norm in the past. I think as we look at reopening to assisted living facilities, other, our residential care homes, is we'll have to have some sort of means of assuring us that one visitor, which is probably, one to start, hopefully it'll be more in the future, but having that one visitor come, we are certain that there is minimal to no risk of having that person even possibly bringing COVID-19 into the care home because of the close proximity of living quarters. So I'm sorry, that's a long answer to a very short question. The word that I've heard is there will be a point, hopefully this year. We are looking hopefully at the summer. And I think the news reports that are coming out now also puts a little bit of doom and gloom for the fall. So when the flu season starts up again, what does that mean? Hopefully we'll have better knowledge of the virus itself and better knowledge of the means to be able to mitigate the virus come the flu season, and then starts all over again. So that's what we've been discussing recently, and like with everything relating to coronavirus, that could change next week. So I'm hoping to have a better answer towards the ending of the month. I will say internally we're discussing about opening in the summer. When in the summer, you know, we can't pinpoint an actual date. We can target a date, move it, but hopefully we want to be able to have that opportunity for people to visit again, because human interaction is what I think Kupuna thrive on. Mahalo. Thanks for your question.
So one more question. We are
Oh.
pretty out of time, but Diane, if you could answer this in 1 minute.
Okay.
I feel like it is a good question. So how do you monitor your staff going shopping and being out during their free time and not being carriers coming to work?
Totally. So early on, we implemented a quiz. It was one kind of like a check-in for how well do they know what's going on. We are also polling them because many of them have different jobs. And I will say there were 5 other individuals that have jobs in other care facilities. When coronavirus hit, they opted to choose one or the other. So we were able to maintain that. But as far as going grocery shopping or going to, you know, the essential duties, if they need to go to the laundromat or if they need to go to, we have been asking them, of course, we have been issuing PPE. We give fabric masks to them for when they are shopping out in the community. And we've been also getting a tremendous amount of donations from Aloha Harvest, from the Chef Hui. And so any way that we can try and reduce the amount of time that they're in the grocery stores. I mean, we're in Hawaii Kai. I'll tell you, everybody centers around Costco, Hawaii Kai these days. We try and provide that for them as much as possible so that they don't have to be in the grocery stores. We cannot do that for, you know, for a long duration, but what we can do, we will. And education, I think, is the biggest form of protection for our staff. So making sure that they're up to date, making sure that they know how to wear the mask properly, that they're not touching the mask, or how they remove it and how they dispose of it, has all been weekly in services for us. Learning curve for everybody.
Okay, mahalo. So thank you again to Hope, Jeannette, and Diane for joining us today and being our trainers for the webinar. Thank you to all the participants that joined us on Zoom. Thank you to the HIPHI staff behind the scenes, making sure this webinar runs smoothly. As you can see on your screens, just want to remind you to mark your calendars for next week's webinar, Wednesday, May 20th, again from 1 to 2 p.m. We will have a panel of speakers to discuss COVID-19's impact on Native Hawaiian and Pacific Islander communities. Mahalo again to everybody for joining us, and we hope to see you next week. Aloha.
Hello.